Hi everyone, welcome to researchmd.com. Another great presentation today. My name is Dr. Pramil Cheriyath. I'm a practicing physician in the United States, Program Director, Internal Medicine Residency, Transitional Residency, and Associate Professor of Medicine in two large medical schools in the United States. We got a very important and scary topic today. Okay, we're going to teach you the 9 deadly killer signs of heart attack. When you look at heart attack, the number one cause of death in the world is heart disease. Okay. And if you ask, every person, what are they afraid of if they're dying from a heart attack? Because it can affect you, whole family, your loved ones, all of them will be affected by the heart disease. So it's important for us to recognize the symptoms. In the United States alone, the money spent to treat heart disease is like, I think they spend around $300 billion to prevent heart disease. But the amount of people or the people are dying still extremely high. 1 out of every 5 deaths is due to heart disease. Remember that, okay? And it doesn't discriminate against if you're white, if you're black, or like if you're Asian, any race. Even younger people now having heart attack, right? And you can see, like, you always, we think somebody looks so fit, or I run like 15 miles per day, I might not get a heart attack. Everybody can have a heart attack. So it's very important for us to recognize the deadly killer signs or symptoms for the heart attack. That's what our topic is, okay? Okay, so the first sign, okay, we're going to teach you about is the pain radiating to the right shoulder. So if you have chest pain and kind of go to the right shoulder, be very cautious about it. That means you have to go call an ambulance or get to the hospital right away. And if you look at the scientific studies, the likely ratio having a heart attack is around 4.7. That means your risk of having heart attack is extremely high. So emergently go to the hospital, okay? You need medical attention right away. So the next symptoms is like the chest pain going into both shoulders. Extremely dangerous sign. You need to go to the hospital. If you look at the positive likelihood ratio, it's around 4.1. So if somebody said, I'm having chest pain and the pain radiates to both shoulders, very bad sign, okay? Send that patient to the hospital, not to the doctor's office. They need to go to the hospital right away. Now, the next one is like the chest pain coming into the left shoulder. Again, a dangerous sign. So if you look at the scientific studies, the positive likelihood ratio is 2.3, very high risk of death from heart disease. Send the patient to the hospital right away. Let's look at the other symptoms. The other one, chest pain on exertion, okay? What do you mean by chest pain on exertion? Let's say you're doing some bicycling, okay? Or climbing the steps, you started having chest pain. Or you're trying to lift something from the floor and lift it up, then you started feeling the chest pain. That's also a very dangerous sign, my friends. And then if you look at, again, scientific studies, positive likelihood ratio is 2.4. So get that person to the hospital, or if you're having the symptoms, just call ambulance and ask them to take you to the hospital directly, okay? Now, chest pain when you chest pain and you started sweating. If somebody said, oh, I'm having chest pain, I'm sweating profusely or even sweating a little bit, send them to the hospital. Again, a very dangerous sign. You could die from heart attack. If you look at the scientific studies, what is the positive likelihood ratio is 2.0, very high risk, okay? Now, the next thing is chest pain. Like somebody has a chest pain and they like nauseated and they started vomiting, you have to be very concerned. That person need to go to the hospital. Very dangerous sign. You could die from heart attack. And then if you look at the positive likelihood ratio is 1.9. So the next symptom, if somebody said, I'm having chest pain, it was similar to my previous heart attack symptoms, again, risk is very high. That person need to be in the hospital immediately, okay? That's the only thing we can do to save his life. Positive likelihood ratio is 1.8, my friends, a very bad sign. The next sign we're going to talk about is somebody said like, oh, I'm having chest pain, I feel like pressure or elephant sitting on my chest. Again, a bad sign. Emergently sent to the hospital. Positive likelihood ratio is like 1.3, okay? So, and then if you have a blood pressure cuff and if you measure somebody's blood pressure, they're having chest pain, you looked at the blood pressure, systolic blood pressure less than 100, again, it's a very bad sign. they could die. They need to be seen in the hospital and right away, okay? And the positive likely ratio is around 3.9. So those are the 9 symptoms we have to be extremely careful. Please make sure if you have any of the symptoms, send that person to the hospital right away so we can save that person's life. Thank you so much for watching. Please subscribe to our channel.